We've looked at it. Now let's get back and get people vaccinated.
That was Dr. Anthony Fauci talking about getting back into full swing with vaccinations now that the Johnson & Johnson vaccine is back in circulation. Welcome to our In Focus discussion tonight, the state of the pandemic. Every month or so, we like to take a step back and reassess where we are with the pandemic. So today, with the Johnson & Johnson vaccine back in circulation and the CDC's recent announcement on mask wearing, we want to find out where we are and if we are close to returning to normal or something close to that, of course. So joining us this evening in studio is Dr. Erin Fox, Senior Pharmacy Director, and via Zoom is Dr. Sankar Swaminathan, Chief of Infectious Diseases, both from the University of Utah. Thank you both for being here, Erin and Sankar.
Thanks.
Thank you.
We do want to talk to both of you in this segment. First off, about the Johnson & Johnson vaccine. We're going to get to that, but let's start with the CDC announcement. We'll get to specifics of the announcement later in the show, but what are your reactions to the news? Sankar, we'll begin with you and then head over to Erin.
I'm sorry, which announcement?
Which announcement? The CDC's announcement in regard to the fact that we can take off our masks. If you've been fully vaccinated, you don't have to wear masks outdoors.
Yeah, I think the evidence is pretty clear that that the risk of transmitting or getting COVID is much decreased if you're outside, where rather than in an enclosed area. I think that's always been the case, but if you're vaccinated, the risk is decreased that much more. That you should be able to do that safely.
Do you feel like, Erin, thank you, by the way, Dr. Sankar. Erin, do you feel like this is a milestone, the fact that they have now released this officially?
I think it's a nice milestone. It also is a really nice incentive to, help encourage getting your vaccine. These are steps that we can take back towards a more normal existence. And so, just a great incentive to get that vaccine.
I would agree with that. All right, well, let's go back to you, Dr. Sankar, and talk about the blood clots that showed up in patients after they received the J&J vaccine and what made them rare.
Well, they were rare in that, I think there were about 15 cases of these unusual blood clots that occurred in recipients of the Janssen or Johnson & Johnson vaccine. But they were also rare or unusual in the sense that they were spontaneous. They occurred, a lot of them, in people who didn't really have known risk factors to develop these kinds of problems. And they occurred in sort of unusual places. Some of the people had these clots develop in their brain, in veins in the brain. And as you can imagine, that can lead to some pretty catastrophic outcomes. And they also had clots in veins in the internal organs. Mm-hmm. And these, most blood clots that we think of that occur spontaneously occur in the legs, and they can travel to the lungs, and they can be serious as well. But these were in unusual locations, and many of them led to hospitalization. So these were all unusual and also occurred in relatively young people.
All right. Well, and Erin, the CDC putting a pause on that vaccine. What was it looking at, and how could a study be done so quickly?
Sure. So the CDC didn't necessarily do a whole new clinical trial or a study, but they did take a really in-depth look at those rare events. And it sounds like there were about 15 total. And so they really wanted to take a close look at what was going on and what the significance was and if more people would be at risk. But they are rare events.
They are rare events, as you've said. So what does this, for both of you, what does this process say about how the CDC looks at health issues surrounding the pandemic? We'll begin with you, Erin.
I'm really glad that they did the pause to really examine, is this something to be concerned about? I think it shows that the system is working, and the safety surveillance system that we have to find these rare events is in effect.
And for you, Dr. Sankar, we'd like to hear your thoughts on that as well. Again, just what does this process say about the CDC's look at health issues surrounding the pandemic?
I think it's good. It's reassuring that they did such an in-depth analysis. I think it's important to understand that what they were doing was trying to decide from the very big picture what would be the result of just stopping using this vaccine. How many people would that affect? How many people might end up hospitalized if they just cut off the availability of the vaccine, and sort of balance that against the risks of people getting these dangerous blood clots. So I think it was really, in many ways, a sort of a from a public health perspective. We have lots of medicines that do have known side effects,
Right.
and some of them are pretty serious, but we don't take those medicines off the market because we need to have them available for the people who really need them. So it was that type of analysis where they were trying to gauge the sort of utility to the whole country versus the risk to individual people.
So fascinating. Yes. Okay. So we want both of you to hold your thought right there. We're going to continue this conversation again with Dr. Erin Fox and Dr. Sankar Swaminathan again after the break. We'll see you in just a moment.
Some people also were wondering, is this really important for me to get? Maybe I'm young, maybe I'm in a lower risk category. And the answer is absolutely yes. It's still important for everyone to get vaccinated.
That was U.S. Surgeon General Vivek Murthy talking about how people still need to get vaccinated in order to truly move on from the pandemic. Thanks for staying with us here for our second In Focus discussion tonight on the state of the pandemic. We do continue our conversation with Drs. Erin Fox and Sankar Swaminathan from the University of Utah. We are now leveling, we'll direct this to you, Sankar, we're now leveling off in terms of vaccination. So more than 2 million doses of the vaccine have been administered in the state. What do you think of that number?
Well, I think it's great because, not too long ago, that number was 0. But I think we're in the low 20s in terms of percentage of people who've been vaccinated. And presumably most of those people who've gotten one dose will get the second dose. But if you count the people who presumably will be fully immunized and the people who have recovered from COVID, it's still not, anywhere near where we need to be to really have decreasing transmission and safety. So I think we're below the national average in terms of the number of percentage of people that have been vaccinated. So I think we've had tremendous progress, not only in Utah, but nationally, but we need to keep it up. And the fact that it's leveling off is concerning.
Yeah, leveling off at around 20%, as you said. So, Erin, part of the reason a large portion of the state hasn't been vaccinated yet is because of a large number of Utahns are under the age of 16. So how long until the vaccine will be approved for Utah's younger citizens, would you think?
That's a great question. I think, Pfizer has submitted for 12 to 15-year-olds. It's already good for 16 and up, but we just don't know the exact timeline. We know that there are clinical data to show that it is safe and effective in that 12 to 15 group. So fingers crossed that we will get that approval soon.
Yeah, still no exact timeline, but some hope out there that studies are being done. So for both of you, there is an equity issue with the vaccine in Utah. A smaller percentage of people of color have received doses compared to people who are white. What does this mean for the state of the pandemic? Erin, we'll start with you.
I think, people of color have been so adversely affected by this pandemic compared to white people, and we need to do better at making things equitable. We know we have systemic racism in our healthcare system, and so all we can do is keep working to do better.
And Sankar, what would you like to add to that?
I think there's a couple of issues. One is access, and that's what we can try to do something about. We have bilingual public service announcements and press conferences to try to reach as many people as possible. I know that the public health department is making efforts to improve access to people who may not have transportation, who may live in less accessible areas, and so on. And then the other side of the equation, of course, is that many people have hesitancy and trust issues with the medical system, and we have to try to work on that as well.
How? It seems like such a big issue. If either of you have an answer to that, I would love to hear, because I think that hesitancy and the information, knowing that it could change the course of this pandemic, I mean, how do you get the message out so that there's not the hesitancy among these populations?
You know, I think one piece of information that is missing that not everyone is aware of is these vaccines are free of charge. You don't have to have insurance. Your immigration status does not matter. Everyone has access to this vaccine. So I think that's just a little piece of information that maybe everyone might not be aware of, and might be in a small way contributing to some of that hesitancy.
Interesting. Sankar, do you have anything else to add to that, or we can go forward?
I think it's a difficult issue. Yeah. I think that people do trust, their physicians and the people that they've been going to for healthcare. And I think we have to make a personal appeal to, because, most people trust their doctors. Right. They just don't trust the system.
Right.
And I think we can get there. We just have to keep working at it.
All right. Yes, a big pathway still ahead, it feels like. Well, Erin, finally, it was announced that Pfizer was working on vaccine in pill form. What does that mean in regards to the state of the pandemic?
That would be amazing, especially for access. These vaccines can be very fragile, requiring a lot of refrigeration. When you think about other countries that need access to this vaccine that may not have access to, ultra cold freezers and refrigeration, a pill form would be amazing.
Oh, isn't that just the thought of a pill being a quick vaccination? That does seem too good to be true, but they're working on that as well, which was pretty exciting. All right, well, you have been hearing from Dr. Erin Fox, Senior Pharmacy Director, and Dr. Sankar Swaminathan. Again, we will continue this conversation after the break.
If we move back to a period where we're all crowding in together, not wearing masks, I think about like gymnasiums, I think about concerts, that's a perfect setting for transmission of this virus. And I worry that if we don't get to that, quote unquote, herd immunity, and we go back to the way we were doing things, we're going to start seeing spikes again.
And that was Dr. Eddie Stenium talking about his fear of another spike in the virus, and that we still need to keep our guard up. Welcome to our third and final In Focus discussion tonight on the state of the pandemic. We do continue where we left off with Dr. Erin Fox and Dr. Sankar Swaminathan, both from the University of Utah. All right, for both of you, the CDC released new guidelines about outside mask wearing. Where are you both with the state of the pandemic right now? Erin, you can start. Sorry, you're both so kindly waiting your turn.
Sure. I think it's good to be optimistic, but it's still good to be careful. Definitely a lot of hope with vaccines, but we really, we're not there yet. But so much hope with the vaccines.
So much hope there. Sankar, let's talk a little bit about the genetics part. Viruses adapt, they change, they vary, sometimes through mutation, sometimes through recombination of genes. Talk about the process in the context of why we need to get vaccinated or to herd immunity as soon as possible.
Yeah, so the evolution of the viruses and these different strains that we've seen, people have heard about this. These various strains that have been nicknamed based on where they started to spread, the UK or British variant, the South African, the Brazil variant, and so on. And now there's some variants that have been isolated in California, and the ones spreading in India have some of these same mutations. And the way that the viruses acquire these mutations is, this is just a normal process. When a virus replicates, some random changes occur. And then if those random changes allow the virus to replicate better, to grow better, then they will spread faster or more efficiently. And if they cause more disease, or again, can grow better in your nose and your lungs and so on, then they're going to be more infectious. They may cause more disease. And so the key is that this happens when there's a lot of transmission. If one or two people get sick, there's not a whole lot of replication that goes on, and there's not a whole lot of transmission that goes on. Mm-hmm. And that mutant, even if it occurred, essentially dies out because it has no place to go. And that's why herd immunity is so important, because with enough people being immune, even if it's not complete immunity, even if there are viruses that can escape the vaccine, they tend to die out because they just can't spread. There aren't that many susceptible people to spread to. Right. But if there's a significant proportion of the people that are not immune, that are not vaccinated, or have not already had it, then this process of mutation and more virulent or more disease-causing strains is just going to accelerate.
Exactly, Sankar. Let's talk a little bit more about this too. What's happening in India, parts of the world like India and Brazil, I should say? Does it worry you about a more transmissible or even deadlier virus then, to hear the numbers coming out of parts of the world?
So, there's a lot of things there that I think people don't fully understand as to why it looked like things were going really well in India. They had case declines. And then there's this huge upsurge. And this part of the speculation is that these mutants have arisen, that people, even people who had it before, may be getting infected again. And also that these mutants, these variants that have arisen, are spreading more efficiently, like the UK variant we know does. And that they may be more, transmissible. So I think there's a strong suspicion, no proof yet, that this huge spike in India, unparalleled spike, is partly due to the evolution of new strains.
Oh my goodness, that makes me really worried yet again. Where would you, Erin, where would you like to see the percentage of the population vaccinated in order to stifle or slow these adaptations of the virus?
Definitely trust the scientists on this. We do need to get more people immunized. We need that 70–80% level, and so that means just getting a third of us or even a quarter of us right now is not enough, and that's why everyone needs to get the vaccine.
Still a ways to go. Before we go, we'd love to hear the final thoughts from both of you. About 30 seconds if you could, but please, what the message you want the public to hear from you tonight. We'll begin with you, Sankar.
Vaccination has just been tremendous to me. I've been an infectious disease physician and a virologist, a scientist who does research on viruses for decades, and the progress and this vaccine, is really, it's an incredible achievement and gift. And I hope that people will get vaccinated, because if they don't, the vaccine will essentially become ineffective. Because if there's a large group of people who are not vaccinated, there will be strains that will escape the vaccine, and then it won't be good for any of us.
It's a team effort here. And Erin, your thoughts?
I can't emphasize the need to get a vaccine, strongly enough. I've been helping out with some of our vaccine clinics at the university, and I can tell you it's a lot of work, but it's so hopeful to be working on those clinics instead of thinking about how to add more hospital beds. And so, please get the vaccine so we don't have to work on hospital beds again.
A powerful image there. All right, thank you both again, Dr. Erin Fox, Senior Pharmacy Director, and Dr. Sankar Swaminathan, Chief of Infectious Diseases, both from the University of Utah. Again, we express all gratitude for you joining us here tonight.